Hey, this is Dr. Barry. This video is not for you, okay? This video is for your doctor, for your advanced practice nurse, for your physician assistant, or for your nurse midwife. If you have a doctor that you love, please share this video with them because it's time for doctors everywhere to decide who they work for. If you have a doctor you don't love so much, then you may definitely want to share this video with him or her. I keep hearing feedback from patients that I see in the clinic and friends that I see online that their doctor seems to be only interested in prescribing pills and injections. They don't want to discuss diet. They don't want to talk about any kind of real lifestyle changes. And so it's time for doctors everywhere, including you, to decide who do you work for, because people have the internet now. They don't really need you as their only source of medical information. A lot of doctors out there don't seem to realize this, that while someone is sitting in your practice in the exam room waiting for you, they can be Googling all their symptoms and they can have a pretty darn good idea of what's wrong with them before you ever step in the room. And so when you prescribe them the latest pill or injection that attractive drug rep just told you about and took you to lunch, they can Google that and they can know immediately that there are no long-term studies that prove the safety of that long term. They quickly are starting to realize that the medications you prescribe for them just manage their chronic disease. They don't ever reverse it. More and more patients are interested in reversing their chronic disease. They want to reverse their type 2 diabetes. They want to reverse their hypertension. They want to reverse their eczema. And if you're just prescribing them a pill or a cream or an injection and scooting them out of your office, you're not really helping anything at all except for your bottom line, right? Now, the reason I'm able to talk to you like this, doctors, is because I used to be a doctor just like that. I used to take great pride in knowing all the drug reps by their first name and by knowing the latest studies showing that the latest pill or injection was just the best damn thing on the planet. But I also noticed something else. I noticed that my patients weren't getting better. Their A1Cs weren't coming down. Their blood pressure wasn't getting better. It was just being managed by that pill. And then I'd have to add another pill and another pill and then an injection. Does that sound familiar at all? Aren't you getting tired of that? Because I know I sure was. My practice had turned into nothing but complete drudgery. I had patients I'd been seeing for 10 years for their type 2 diabetes, and the only thing that had changed for them over the years was the number of pills that they now took. They took a lot more now than they did 10 years ago. Their diabetes was no better. The damage being caused to every end organ of their body was not any better. They were being damaged and harmed every single day of their life because I was an idiot. I was too interested in prescribing Big-pharma's pills, and I had no interest in trying to actually help my patient take charge of their health and reverse their chronic diseases. Now, if that sounds familiar to you, if you're like, yeah, that kind of sounds like what I do every day, and also if your practice has just become pure drudgery, if you almost hate going into the clinic anymore because you know you're not really going to make any meaningful difference in anybody's life, except for big pharma, you'll make them more billions maybe, then it's time for you to make a decision. First, in your mind and in your heart, who do you work for? Do you work for your patients and for their long term health? Do you work for your patients' families? Do you work for the children who would love not to lose their mom and dad to chronic kidney disease or a heart attack or a stroke? Is that who you work for? Because I hope it is. If so, that's good. Keep doing what you're doing. If you, however, say, no, actually, I guess I kind of work for Big Pharma because all I'm interested in is prescribing pills and checking the minimum labs, and that's about it. I don't really care if my patients reverse their disease with simple things like dietary changes. I just want to be the guy that knows about the latest drug from Big Pharma. Then I guess that's okay. But I think you need to start letting your patients have informed consent. You need to tell them right up front, you're not interested about reversing their chronic conditions and you're not interested in them having a longer health span and a longer lifespan. You just want to prescribe drugs. And I think if you tell your patients that right up front, you'll actually attract patients who don't want to do the work and do the learning and and reverse their chronic health conditions, you'll attract patients that just want pills and injections and excuses that they can blame things on. Oh, I just have diabetes. It's a chronic progressive disease. There's nothing I can do about it. Just have to take all these pills and these shots. And you'll attract those patients, and then you can have a practice full of those patients. But then also you will have informed the other patients who want to take charge of their health that you're not the doctor for them. Okay. And I think that's intellectually honest, don't you? If you are that doctor right now, just realize you don't have to be that doctor forever. You can change. You can change your practice. You can change tomorrow. And you can start doing your reading about a low carbohydrate, high fat, ketogenic diet, about intermittent fasting, about how to get better sleep, about how to improve your lifestyle, about how to decrease stress and the cortisol that comes with that. You can start to learn about all those things. You used to be a student, right? You used to be a medical student. You could learn a lot of stuff really fast. So unless you're done being a student, unless you're done learning, then I would really strongly consider this and just perhaps consider that the AMA and the ADA and the AHA's recommendations, look back over the last 10 years. Have they really helped your patients be healthier? Because they hadn't helped mine at all. It's up to you, doctor. This is Dr. Berry. I'll see you next time.